Welcome back to Studio 10. We're going to talk about breast cancer for a few minutes. As we all know, cancer does not discriminate. Sometimes women who are diagnosed with breast cancer end up having no choice but have one of their breasts or maybe even both breasts removed. My aunt just went through this. Of course, not having breasts would make any of us feel like less of a woman, but there are options. Dr. Christopher Park from Mobile Plastic and Reconstructive Surgery and Dermatology explains. This morning we're sitting down with Dr. Christopher Park and we're talking about Breast Cancer Awareness Month. Breast cancer is real and it's very scary, especially if you're going into it and you say, okay, what am I going to look like after this? If I have to have a mastectomy or if I have to have a lumpectomy. Dr. Park can help you out with that, right?
Yes, breast reconstruction is a very important part of breast cancer and its treatment, and it's a very dramatic and traumatic time in patients' lives. And they certainly, if they're considering mastectomy or just having a tough time deciding between mastectomy and breast conservation therapy, they should talk to a plastic surgeon.
Okay, so those are the two options, the mastectomy and the lumpectomy. Now, what can you do to make a woman feel more like a woman if she does have to have something like a mastectomy?
Obviously, there's a lot of different paths to go down, but in terms of reconstruction, we're most often involved in mastectomy reconstruction, meaning the entire breast has been removed. And there's two different timings of those reconstructions. We either do immediate reconstruction or delayed. Immediate means that we're there at the time of the mastectomy and we get started. It doesn't mean we're necessarily done at the end of that operation. A lot of these operations require 2 or 3 steps in the series to get us where we want to go. The other technique is delayed reconstruction, which just means months, years, whenever after reconstruction a patient can say, I'm either mentally or physically ready to proceed with reconstruction now, and that's when they may present to me.
How does this consultation usually start with the plastic surgeon?
The most important thing is getting the history, determining what has happened, what kind of treatment's been completed, radiation, chemotherapy, review the surgical history, and then look at the other breast, if the other breast is still there, and the body, and determine what I think the best option is for the patient.
Okay, now who is not eligible for something like this? Is there anyone?
No, there's not. No. I mean, everybody is eligible.
Okay.
There may be people we decide not to do surgery, but everybody is eligible.
Okay, so you may decide there's a different path to take.
Right. I mean, it's a very detailed consultation, and a lot of variables to consider. In some patients we may decide reconstruction is not the right route, or that patient or I or their breast surgeon may decide breast conservation therapy, meaning a lumpectomy. But one thing patients need to know is almost any patient that gets lumpectomy, or there's other terms such as quadrantectomy or partial breast excision, are going to require radiation, and that does have some implications too.
Okay, now once you have breast reconstruction, how real would your breasts look? How normal?
We can get them very normal. They're never going to be totally natural. They're never going to be scar-free. But we can get pretty good symmetry in most situations. Sometimes we have to do surgery on the other side, either a lift or an implant or some other type of surgery to get them to match. But by the time we finish, it's usually a pretty good match.
Very good results. Now, I know that every one of us has been touched at some point, whether it's a family member or a friend, knowing someone who has breast cancer. If someone is out there and they're watching right now, they've just been diagnosed with breast cancer, how could you put their mind at ease? How common is this? Let them know that they're not alone.
It's very common, and we used to say that 1 in 9 women is going to develop breast cancer. That number's now gone to 1 in 8. So it's extremely common. But what they do need to know is that there are options out there for reconstruction. If that's the route someone's thinking or heading, a plastic surgeon would rather be involved early in educating the patient and discussing things like the kind of surgical procedure done and radiation effects. And just kind of letting them know the gist of each type of procedure, because they're very different, whether we're talking about expander and implant reconstruction or using tissue from the belly or tissue from the back or tissue from the buttock. There's a variety of procedures that we can combine to figure out the right thing for the patient.
So many options, but you can make them feel more like they used to before they were diagnosed.
Yes.
Okay, so if you've just been diagnosed, you know someone who's diagnosed, you're scared, they're scared, talk to your doctor and know that there are options. Thank you, Dr. Park.
Thank you.
Of course, the primary goal in the management of breast cancer is to cure the disease. But again, part of the healing process may include the physical aspect. If you would like to talk with Dr. Park, you can make an appointment and see him in his office, which is located at 3153 Dauphin Street.